Hi, everyone. I'm Jay Watson with Emory Brain Health Center, and I'm joined today by pandemic expert Dr. Carlos Del Rio, who's the Executive Associate Dean of Emory University School of Medicine at Grady Health System and a professor of medicine, global health, and epidemiology. Dr. Del Rio, as always, it's great to see you.
Great to be with you again.
We're going to get cooking right away. We've got a ton of questions this week, as always, and we'll begin with our first one, which is, it's been 3 weeks since Georgia opened, and the numbers are not worse. Doesn't this mean Governor Kemp was right to open the state? It looks like the doomsday predictions were wrong.
It could very well be. I think that the numbers are not coming down. The numbers are stable, right? They're steady, and I think they're not going up. But I think we still have a number that is steady and it continues. And I think we just need to watch it. And I would like to see the numbers start to come down, but again, it's too early to tell, and I'm glad they haven't gone up. As I said, and I will say it over and over again, the thing I wish the most is that I'm wrong. I want this to be that we don't have an epidemic. When you think about a pandemic, when you think about an epidemic like this one, you need to prepare for the worst and hope for the best.
Has it been long enough to be able to tell, though? So it's been 3 weeks. Is 3 weeks an accurate amount of time to be able to tell?
Well, again, there's not a point at time because just because the governor opened things up doesn't mean that everybody went out of their houses and started doing things, right? You could still continue sheltering in place. You could still say, well, I'm not going to go to bowling alleys. I'm not going to go to haircuts. I'm not going to do this. I'm not going to do that. So it's really up to what the people did and not necessarily what a governor decision was. So I would say, let's just wait. But again, I don't want the numbers to go up. I really want the numbers to go down.
For sure. Is Georgia receiving remdesivir in needed quantities?
Georgia is receiving remdesivir. I think is receiving some remdesivir. We need to get some more. But I think we are getting remdesivir, and that's good.
If you have the antibodies, can you be a carrier?
Well, what do you mean by a carrier?
That's what the question says.
I think if you mean, can you continue being infected forever? No. This is a viral infection in which you get infected, you get over it, you develop antibodies, and most likely you're protected. For how long is the question? Are you protected for a couple months, a year? We don't know.
And in case this person is asking about how long someone could be infectious to others once they've had the virus, what do we know about that?
What we know from several studies is that you probably remain infectious for about 10 days at most.
Okay. Is testing in Georgia sufficient and accurate yet?
I think testing is getting there. It's not quite where it needs to be, but it's making enormous progress. We got a lot more tests done now than we did some time ago. I think we need to get even more tests, but we're getting there. When they ask about accurate, I think all the tests are very good, depending on who does them and how they're being done. But I think it's more an issue of accessibility and affordability. Can people be able, which anybody who wants a test can get a test? And the answer is we're getting there, but not quite there yet.
Please talk about herd immunity and if we should allow ourselves the chance of getting sick in order to build herd immunity.
So herd immunity it's a term that people sometimes, I like the term community immunity, community protection, right? Herd immunity is this term being used in which what it means is that if enough people in a population have had a disease or are protected from a disease because of a vaccine, and we typically think in the terms of vaccine disease. So if X percentage of the population is protected by a vaccine and X percentage of the population already had the disease, the number of susceptible individuals is lower. So herd immunity has to do with that protection of everybody. So the reason you take a vaccine is two reasons you should get a vaccine for measles, for example, is to protect yourself, but also to protect others, because you're protecting the herd by doing that. In this disease, in order to reach herd immunity, in the absence of a vaccine, you will need to get about 60% of the population infected. And that is just simply a really, really high number. Because even today, when we have a pandemic, given the worst circumstances, New York City maybe has 20% of its population infected. And you've seen how many thousands of people have died in New York. So the cost in terms of human lives and in terms of hospitalizations would be simply too high. And I realistically don't reach herd immunity until maybe 2022 or 2023 if we just did herd immunity. And that's why a vaccine is necessary.
It seems backwards to me to quarantine everyone. I understand anyone at high risk staying at home. It just seems a little bit better idea for us all to go on with our lives than upon showing symptoms to seek medical assistance. Determine through testing who has COVID-19 and quarantine those who test positive from otherwise healthy people. Is that what we should do?
I think the shelter in place and the quarantine was needed initially to sort of try to stop the rapid progression, right? And to also try to make sure that our hospitals didn't get overwhelmed. Now, as you begin to open and you begin to let people go out, exactly what this person is proposing is what you want. You want to test individuals, you want to isolate them when they're infected. The problem with this disease is that not everybody who gets infected has symptoms, and some people are able to transmit before they get symptoms, and that's the challenge with this infection: is the asymptomatic and the pre-symptomatic transmission. There was a study done in a nursing home in Washington State in which they tested all, I think, 60 or 70 residents of the nursing home, and I think about 50 were infected. And of those 50 that were infected, about half had symptoms and the other half did not.
Are the antibody tests accurate? If some are more accurate than others, which does he recommend? If an antibody test comes back positive, is it safe to visit elderly family members?
The antibody tests are a little bit of the wild, wild west. There's all sorts of antibody tests. There's some that are better than others. I'm not going to specifically recommend brands, but some brands are better than others and are doing a better job. I think we need a better idea of which test you're going to be using. But some of the tests are better, and if you have that test and you're positive, you have had the illness, you are protected, and you probably can take a little less stringent restrictions. But I would say that it's still convenient to take some precautions. So you can go visit relatives, but I would still wear a mask. I would probably still be careful in what I do, because especially with older relatives, you don't want to get them infected.
If you are using a surgical mask, how long can you use it before needing to change it out for a fresh one?
Probably no more than 8 to 12 hours, a surgical mask.
Please talk about the pediatric inflammatory disease happening in New York. Have we seen any cases in Georgia? Do you think we will?
So what we're seeing in children is, it's first of all, we didn't think children got this disease. Now that we see children getting it, we see some children having some unusual manifestations. One of them is an inflammatory disease called Kawasaki illness, which is an inflammatory disease that typically would occur after some bacterial and viral infections, and it causes a red tongue that looks like a strawberry. It causes some inflammation, including of the heart. We are probably seeing it in Georgia. I'm not a pediatrician, so I don't know how many kids have it, but it's certainly a very interesting manifestation. The other thing we see in kids is, and also we see it in adults, I've never seen it, but it's called the COVID toes, in which the toes get purple, and there's some really interesting manifestations of this illness.
Now that Georgia has opened testing for everyone, regardless of symptoms, would you encourage people to go get tested even if they are feeling well?
That's a tough question. I think if you think you should be tested because you were exposed, because maybe you did something, maybe somebody in your school or work got infected, I think it's worth getting tested. But if you're not in a high risk position, if you've been sheltering in place, then I see no point on doing it.
Neighborhood pools are advertising they are opening. Do you think this is safe?
Well, again, if you can stay 6 feet apart from others, if you can go swimming and then get out, and then it depends what you do. I mean, at the safe, the most dangerous thing in a pool is probably not COVID, but it's probably drowning, right? So I think that we need to as humans, we need to put safe into perspective, and we need to say what is safe. Nothing we do any day is 100% safe, but there's certain things that are more risky than others. And I think we need to put risk into the equation and say, if I go to the neighborhood pool and it's 6 o'clock at night, I used to go to my neighborhood pool in the evening, and it was just 5 or 6 people and we're all spreading apart, it's totally safe. Now, if I go at 10 in the morning on a Saturday and there are 100 people, it's probably not safe.
There were some who thought that chlorine killed the virus. We got that question a few weeks ago. Do you remember that? Have you heard anything about chlorine killing?
Well, the virus is going to kill, again, you're not going to get the virus by being in the swimming pool because of the chlorine, right? You're going to get the virus because of the people when you're outside, when you're in the dressing room, when you are, out in the deck and somebody comes and talks to you.
Right. If cleaning teams can safely disinfect restaurants and subways, can my housekeepers return to my home? If they wear masks and gloves, am I safe to return a few hours later?
I would say probably so. I mean, I think, again, wearing masks and gloves and doing hygiene are really important steps, and keeping that 6 feet distance, right? That social distancing is going to be very important.
Should we be wearing gloves in public? I'm wearing my mask when I go out, but should I be wearing gloves too?
I'm not a fan of wearing gloves in public. I don't think it's necessary. I'm a fan of hand sanitizing and cleaning your hands. But I don't think you need to have gloves in public. Having said that, I know, for example, my wife likes to wear a glove when she goes to the gas station to pick up the nostril, and she'll use it for that, so she doesn't touch the nostril and the keypad that everybody else has touched. And then after that, she throws the glove away. She's not using it all the time, but for that specific activity, I think it makes sense to wear the glove.
Another question about reopening. Does he feel Georgia is going too far too fast with reopening, or is he comfortable with the approach? Does he worry that people might have a false sense of security and thereby put others at risk?
So too many questions there. I'll start with the end. Do I feel people have a false sense of security? Absolutely, and I worry about that. I mean, I saw it last weekend driving around Midtown of, hundreds of people walking around in the park, in Piedmont Park, and not wearing masks. I think we need to be careful. This virus is not gone. We should not be cavalier. And I think we need to take precautions. And I think we still need to continue. Again, I'll emphasize it again, practicing social distancing, wearing masks in public, and hand sanitizing significantly.
An epidemiologist, Dr. Joseph Fair, who's a contributor for NBC, is hospitalized. I saw in an interview that he says he got COVID from a plane trip to Louisiana. He thinks he got it through his eyes on the plane. How easy or difficult is it to get it through your eyes, and how can we prevent it if it is easy?
So eyes has become an increasingly interesting area of transmission. And there are several people, including some colleagues of mine that are hospital infection experts in Iowa, who have published a piece saying that we should all be thinking when we go on a plane or in a public place like that, either wear goggles or wear a face shield. And I think it's not a bad strategy if you're going to be in a public place like that to wear goggles or to wear a face shield.
Do you think that is because of the recirculated air in the plane that would make it different?
No, it's because if I'm talking to you and you may be wearing a mask, but as I'm talking, if I'm infected and I'm releasing viral particles in my saliva, they can also get into your eye, right?
Yeah, because he also said the plane he was on was crowded too.
Yeah.
What are your thoughts on salons opening and offering services with the client and the hairdresser masked?
Probably okay. Again, in a salon, you have close contact, but you also have few people, right? There are different situations, right? Do I feel better about a salon with both people masked than I feel about a concert with 1,000 people? Yes. I think, again, it's an issue of nothing is going to be 100% safe. And I think you can always find problems into what you do. But at the end of the day, we need to figure out what is the safest thing to do. I think about it as I'm driving, right? At one point in time, is it safe to run a red light? At what point in time is it safe to not wear my seatbelt? There's certain things we do because it's the right thing to do and we're trying to be safe. Now, did you say, well, I ran a red light today and nothing happened to me, therefore it's okay to run red lights? I would be careful about that.
If my child's overnight summer camp opens in 3 weeks with limited participants and health checks, should I send her?
When I think about summer camps, if everybody that went to the camp was tested, everybody was negative, they all got in a bus and they all went to this one camp, nobody else came in from the outside, they stayed there like a secluded island, I guess it's possible that this is going to be safe, right?
Okay. Should we attend routine dental and healthcare visits?
Well, I think routine visits can be postponed. I think urgent visits need to occur. And I worry about people not taking care of what is important, which is the healthcare. And I worry also with children that are not getting the immunizations. So certain things, health maintenance like immunizations, certain things like, colonoscopies and other things are going to have to happen. We cannot just not do those things because then we're going to have outbreaks of other diseases.
My friend's church still meets on the weekends. Recently, one pastor even visited a COVID-19 positive patient at the hospital. What do you recommend we tell people who don't take precautions?
I think we need to tell them that this is the wrong thing to do. I think you're putting, not only you're putting yourself at risk, but you're putting others at risk. And I think, again, we all need to take responsibility. We don't want to get infected. And as I tell people, I don't want to see you in my hospital.
How soon after a person is exposed or infected by the virus will test results show positive?
Probably about 3 days after exposure.
What have we learned about reinfection rates? From what I've read, the COVID test is unreliable, false negatives, and the antibodies test is fairly useless until we know more about reinfection. Are we making progress on more reliable testing options?
Well, let's put it this way. Let's start with the first point. The testing is not unreliable. The false negatives are not because the test necessarily is bad, but because what we do to get the test is bad. So we didn't get the right swab, we didn't get it on time, we didn't take it to the lab the right way. Well, if we do the test the right way, when somebody's infected, the test will be positive. So it's not an issue of the test not being good. It's an issue of the test not being done the right way. The tests are very reliable. The antibody tests, same thing. There are good antibody tests and bad antibody tests. And as I said before, I think there's enough evidence of immunity out there that we don't need to worry about it. I think people that you are unlikely to get reinfected. I think a few cases we've heard about of reinfection are rare enough that they've been written up in the medical literature. When we have 4 million people infected out there, there may be a handful of reinfections, and some of those I'm not even sure they're not, just continuous shedding of the virus.
What is your health guidance for parents in Georgia now having to make choices about daycare and day camps reopening?
Check on how that day camp and daycare is taking. What are they doing for cleaning? What are they doing for social distancing? What are they doing for masking? I mean, I would just check each one of them, and I would be sure that everything is safe.
With regard to the statistics on the Georgia Department of Health website, is it not better to look at the change in number of deaths from day to day versus the change in number of new cases? The reason I ask this is because the number of new cases for today will not be accurate for at least a week or longer, as it takes this long to receive and tabulate the test results.
Well, also, I'm telling people that the number of cases is less an indication now of what's going on. And the reason for that is, as we're doing more and more testing, and we're testing outside of healthcare facilities, and we're testing asymptomatic people, the number of cases is telling us something. It's going to grow because we're doing more testing. But I'm starting to get more interested and more focused on tracking number of ER visits, number of hospital beds being utilized, and number of deaths. Those are probably a better indicator of the burden of disease. The number of cases, in fact, you want more testing to happen. As more testing happening, the seroprevalence should come down.
If a patient is symptomatic, positive exposure, their test comes back negative, should they continue their 14-day quarantine assuming possible false negative, or is it appropriate for them to come off quarantine early?
If they have symptoms, I think they should stay in isolation because it could be a false negative. If they don't have symptoms and the test is negative, I think they're negative.
Dr. Del Rio, you just talked about this a little bit before this question, but I'll ask this. For those of us who are following the numbers, is there a number of daily cases or deaths that you have in mind that would make you feel we are out of the woods?
I want to see cases and deaths coming down. I mean, I think, again, I think we're far from going out of the woods. I think I want to see first that we're in the right path to get out of the woods.
Would it make more sense to quarantine people who test positive than those at high risk while allowing the rest of society to continue as normal?
Well, that's what opening is all about. Opening is all about identifying and isolating those that are infected, protecting the elderly, and letting everybody else go about. But again, we need to make sure that everybody else doesn't get infected.
I got so many of these questions today, Dr. Del Rio, I had to narrow it to one. A lot of people asking about booked vacations for this summer. So I took the more than 10 questions I got about it and narrowed it down to one, which is, we have a vacation booked for the beach. Are we safe to go to the beach? Can my kids swim with other kids in the pool in the ocean? What about going out while we're there? So lots of questions, people dying to get away and go somewhere.
Well, I mean, are you okay going to the beach? Again, if you can keep certain degree of social distancing, I think you're probably okay. Who are you going to be with? Are you okay going to a restaurant that is going to be full, or a bar when you're in the beach? Probably you're not going to be okay. So I think it's really some things are going to be okay, some things are not going to be okay. And I think it's not an all or non decision. And I think we're all making those kind of decisions. I mean, I'm thinking about going to the beach this summer, but I'm thinking about going to the apartment or the house beach, and and getting some groceries and staying there, and not going out, and it's probably going to be totally safe.
Is he having any conversations with school districts or universities about fall plans? And if so, what's his advice?
I'm having a lot of conversations, not with school districts, but I'm having a lot of conversations with universities, particularly here with Emory. And I think we're trying to look at what is the safest way to do this. And, do you go all the way, as University of California has done, to say everything is going to be online? Or do you go all the way to say everything is going to be fine and everybody's coming into school? What is the medium? What is at this point in time, we're thinking here at Emory of students coming back, but we're trying to figure out what is the safest way for students to come back, and what kind of strategies can we implement for students to come back.
Is there any role for a pandemic alert system, red, orange, yellow, et cetera, that we can ramp up and ramp down as needed? Is there concern that with the next pandemic, it could require more serious PPE like PAPR/CAPR that we just do not have in large quantities like they do in other parts of the world?
Yeah, I mean, I think pandemic preparedness is something that is going to have to be reevaluated at the end of this pandemic. I think we all have learned, as much as we tried to prepare, as everybody has said, your preparedness plans go to hell once you get the real situation. But what you have to do right now is, at the end of this, go back and review your pandemic plans and say what was wrong and what do we need to do better to be better prepared for the next occasion.
This question says, I don't have SOB, fever or cough, since 1 month. What does SOB stand for?
So shortness of breath. That means that I'm having trouble breathing.
Okay. But still have severe fatigue and occasional tachycardia. Should I get tested for antibodies now or wait till fatigue is gone?
I'll probably wait. But again, I don't like to give medical advice over Facebook.
Right. Another very popular question we had to narrow down. What recommendations do you have regarding gatherings right now? Some people asked even about weddings, people who had spring weddings, who've postponed them to August. Now, August isn't that far away.
I would say limit the number of people. I would say, at this point in time, nothing more than 10 people is probably safe. I think we're not ready to have maybe a small wedding, but not having a wedding of, 200 people or something like that.
Do you think people should still stay home if they can?
I think people should still stay home if they can. I think people should still practice social distancing as much as they can. I think we're not back to normal. And I think that needs to be very clear to people.
The last thing, Dr. Del Rio, isn't necessarily based on questions so much as things people have been writing to me and messaging to me about the fatigue they're feeling from this, and the sadness and the heaviness. And I think there's a certain level, I'll use the word despair, of feeling that this isn't going to be gone anytime soon. And some people have projected this is something we'll deal with for years. So for people who are feeling that way, and I almost put myself in that camp, how do folks keep going? I'm sure it's even.
Well, I think you do a couple things. I think number one, I think we need to keep hope and optimism there. I think we need to realize that humans and societies have gone through terrible things over time. And the one thing we've learned from humans is that we are resilient and we have adapted. I think about, I read history and I read about what the First World War was and the Second World War, and what the entire continent of Europe went through during the Second World War, and the amount of suffering and destruction that occurred. I think we all would have felt the same way. We all would have felt despair and that the world was ending. And yet we came out of it and we recovered and we did fine. The pandemic of influenza of 1918, the Spanish flu, was pretty similar to this. I mean, it was, 50 million people died worldwide. 500,000 people died here in the United States alone. And yet we're here. We recovered. I think that We need to have hope. We need to have optimism. We also need to assure ourselves that science is helping us. Science is in our side. We have science today like we've never had before. The time between the isolation of this virus, the sequence of this virus, and the first vaccine going into humans was 63 days. Nowhere before in the history of mankind have we gone from a new virus to having a vaccine in such a short period of time. Science is, we now have medications like remdesivir that are showing efficacy. I think science is on our side. I think with science, we're going to be out of this. But we're not going to be out of this immediately. This is not, pressure cooker science and Instagram science that happens overnight. This is going to take some time, but we need to be patient and optimist, and we're going to get out of this. And I think if it's going to be 6 months, if it's going to be a year, it's going to be 2 years. I don't know, but it's not going to be forever. Hopefully, we're going to have a new life, a new normal, and a new way of thinking about life, and maybe a better life. I think that rather than going back to where we were, we need to go forward to a new life, and maybe a life that focuses more on thinking about others. Because again, I wear a mask because I want to protect others. Focuses more on equity. I mean, I think we've seen in our country and across the world enormous differences happen in socioeconomic status, and now we're seeing how that is impacting this disease and how we're having a lot of problems because people, don't have the means to isolate, don't have the means to stay home, don't have the means, and that's continuing the pandemic. So I think we can also go to a better world in which there is more equity, there's more international collaboration, there's more humanity, and there's more humility. So I am hopeful that the end result of this may be much better than the place we were before. So don't be down. We're not there yet, but we're making progress, and we're going to be out of this. I'm 100% sure of that.
Dr. Del Rio, I think that's the perfect place to leave it. Thank you. Thank you for your words of advice and encouragement. And I too believe science will get us out of this. So thank you. We'll see you next week.
See you next week.
Be well.
To you too.
All right. Bye-bye. Thanks, everyone. Take care. See you next week.